you're starting. So first and foremost, do I have permission to use this testimonial for educational purposes on social media?
Yep.
Okay. So first, I'd like to ask you, what did you have done at Inspired Spine here?
What I had done at Inspired Spine was I had their OLLIF fusion procedure on my L4 through my S1.
All right.
Back in September.
How long have you had the pain before you had surgery? So tell me a little bit about before surgery.
Before I had the surgery, I had fairly severe back pain for about 2 years, and then about 8 months to a year before surgery, I lost the use of my left leg. Couldn't move it, just numb, crippled, wasn't there. My pain was, I know the scale is like 1 to 10 on the scale. Mine was probably about an 18. I mean, I'd be at work crying just trying to stand to help people.
I'm very sorry. No, thank you so much for sharing that with us, because that's real. That's so real. So tell me a little bit about the things you did before surgery. So whether that was physical therapy, injections, chiropractors, ibuprofen, yeah.
To help me with the pain as much as I could before I had the surgery that fixed me, I did some PT, that's worthless. I did the shots, that made it worse, especially being the guy missed on the left side. And yeah, I don't want to talk, that was bad. Just like, basically got to the point where nothing over the counter worked, nothing helped, so I just mentally taught myself to deal with it, because I figured, because I kept getting no's from 4 other surgeons told me no, because they said you're too fat. Your BMI is too high, you're too tall, you're a risk, you've had other surgeries, we won't touch you. Until I came to this place.
I would absolutely love if you feel comfortable talking a little bit about those people that tell you no. We get that all the time, whether it's BMI or some health risk that they have that we can eliminate here. So I want you to tell me a little bit about like that process. You know, you went in, they said no. How did you feel about that? How did you find us? That type of story.
Okay. The first one I went to told me no because my BMI was too high, which, you know, I'm a big dude, but that's a bunch of bullshit. The second one I went to, these were all at Fairview, by the way, because that's where I had my other ones done at. I went back to Fairview. Second one gave me a 45-minute schooling session on dieting and weight loss. Never talked once about my back. The other one was Essentia up in Duluth. They said, lose weight first, then we'll talk. And then the other one, and then the third one was at Fairview, actually. They just said me flat out no, because the area is too unstable from my other surgeries, so they won't touch it.
Well, thanks for sharing. Yeah, we get a lot of sad stories about people being turned down.
And I looked at him and said, well, I'm a 39-year-old man that lost my career over this. I said, I will not live the next 40 years of my life like this. Thank you very much, and left.
Mm-hmm. How did you hear about Inspired Spine?
Believe it or not, Google. I was Googling spine stuff, and my mom was helping me too, and came across this place, saw the website, read the reviews, read about Dr. Abbasi, the other people that work here, and went, I'll give it a shot. Can't hurt.
That's right. Okay, so let's fast forward a little bit. You had your initial visits with Dr. Abbasi. Mm-hmm. You're going to have surgery, and kind of walk me through kind of what you thought surgery was going to be like. Like, did you feel informed? Any kind of advice you'd give yourself before having surgery, like you wish you knew?
Honestly, when I was first preliminary visit with Abbasi, which that guy was awesome from day one. I mean, from the other side of the room, you saw the screen and went, you have 2 flat tire. You need surgery. Just like that, from 15 feet the other side of the room. And then got up to the surgery day. I went to the Maple Grove Center for Restorative Surgery. They're very professional, very courteous. Everything was great, from the lady at the desk, the nurses, everybody. The other, I guess you could say, outsourced facilities they use for like the nerve stuff they did and whatnot. That's all great. I mean, and as far as prepping myself for it, I couldn't get in that gurney bed fast enough because I knew what they were doing. I knew, because I was fully informed, like what the surgery was, what they're doing, what the hardware looked like, because they showed me like the 3D models of the spine ahead of time, so I knew exactly what was going to happen.
Perfect. I love that. So we just finished surgery. Tell me a little bit about after surgery? How long were you walking? Kind of how was the pain? How was your recovery?
Okay. Post-op and actually in the recovery room, because I mentioned before my left leg was dead, I was walking with my left leg immediately in recovery room. I had a walker to help, but I could move my leg. And then I went home, and then the first 2 weeks or so were rough. Obviously, I just had major surgery, but they were rough. I had to walk with a cane a little bit. After about a month or so, I could walk unassisted. That's about at least a mile.
So on a scale of 1 to 10, where are you at pain-wise or symptom-wise now, about
Okay.
4 months out?
All right. I'm somewhere between actually 5 to 6 months post-op. And I don't call it pain, I call it like stiffness and discomfort, stuff like that. I do not have pain anymore, not real pain.
Perfect. Any last comments before we wrap this up that you want, anybody else to know, the public, any comments for Dr. Bossy? Free for all right now.
One thing I'd like to share with people is if everybody else is telling you no versus because of your age, medical stuff, you're overweight, whatever it is, and you need a place to go, this is the place to do it. Just flat out, don't even think about it. Just sign the paper, hand them your insurance card, and on you go.